So, what other preventive measure aside screening will you recommend regarding cervical cancer?
Okay. Avoid all the risk factors we've mentioned earlier. The smoking, control your weight, avoid multiple sexual partners, take a lot of fruits and vegetables, all right? Go for regular medical check. Just avoid all those risk factors and you will be okay. Then another means of preventing is the vaccination. Vaccination with the human papillomavirus vaccine, which is available for girls that are aged 9 to 14 years.
Okay.
Yes,
so anybody above 14 does not get vaccinated?
They can't be vaccinated, but you have to discuss that with your doctor because a lot of things are involved. They have to screen you and all of that to be sure you've not gotten it. They target that age group because they believe that most girls wouldn't have become sexually active. All right. So when they are vaccinated, they are covered, and like it's like a herd immunity. Herd immunity is like when a particular group of people are kind of vaccinated for a particular disease or infection, and they're in a community, like they tend to like reduce the rate at which that disease will spread and all. So imagine you've targeted 19 to 14 years in a particular country and they are all vaccinated, all right, even if they are exposed sexually, they won't come down with the human papilloma virus and they won't get to spread it. And also, boys can be vaccinated, not just girls. Yes. Exactly. So boys can be vaccinated too.
Within the same age bracket?
Yes, within the same age bracket. So it doesn't mean that if you're above 14 years, you can be vaccinated, but you have to discuss that with your doctor because there are a lot of factors to consider. Yes.
So boys can be vaccinated. So when it comes to this, what really does, if a guy is not vaccinated and he's with the virus, it means if he has sexual intercourse with a lady that has been vaccinated, can it be transmitted?
If he has not been vaccinated,
then he has intercourse with a lady that has been vaccinated. Can the lady go down with?
The lady is covered.
Okay.
So that's why vaccination is important. It's just like babies. When when you give birth to a child, they will advise you to go and vaccinate your child. For instance, the first vaccine a child gets is the BCG. All right, it's one of the first vaccines a baby gets. So that BCG protects the child from tuberculosis. So even if tuberculosis is spreading, is in the atmosphere, it reduces the chances of that baby coming down with tuberculosis to a very great extent. So that's the same way it applies in this situation. So the chances of the girl being infected with the virus is very minimal.
Okay.
Yes.
So now the WHO said something very striking. It said, when diagnosed, cervical cancer is one of the most successfully treatable forms of cancer as long as it is detected early and managed effectively. Now, this brings me to my next point, management and treatment.
Okay.
So, how can it be managed? How can it be treated?
So, if someone has been, let's say you went for the screening test and they saw that you have precancerous changes or you already have cervical cancer, key is that if it's detected early, like you said, the treatment outcome is usually very good. All right. So the problem is when it's diagnosed, it's not as if even in late diagnosis, it wouldn't be treated, but it's just that it would involve a lot. All right. Something that would have been tackled at the early stage and the thing has gone far. So a lot of things will be involved. So to diagnose and treat it, first of all, you do your screening test. If they see anything, they stage it. All right, it will be staged because there are various stages. What is staging? Staging is, telling us how far the cancer has gone and where it is located. All right, so we have stages 1 to 4, and each of them have, like, stage 1 has stage 1A and B, stage 2 has stage 2A and B, and so on. So if, for instance, okay, stage 1 means that the cancer is still in the cervix.
Okay.
Yes. Then stage 2 means that it has passed from the cervix to the upper part of the vagina, that's the upper to third of the vagina. Then in stage 3, it has gone down to the lower third of the vagina. now involves the pelvic region, involves the kidney, and involves some lymph nodes. So stage 4, it has now started involving organs like your liver, your lungs, your bones, and other distant lymph nodes. So you can see the progression. So something is dictated in the cervix. What they just have to do is to remove the part of the cervix affected. So before I
And
go
it does
into
not
the
affect the womb.
yes, it does not affect the okay. The part that it will affect the womb is in stage 2.
Okay.
Yes.
When it
All
gets
right.
to the
Yes.
upper two thirds.
Yes. It's in stage 2. In stage 1, it's still in the cervix. Do you get? So the treatment involves surgery, chemotherapy, or radiotherapy.
All right.
Yeah, so most times it is surgery, depending on the location. Like I said, if in the cervix, they'll just remove the part of the cervix that has been affected without touching the womb. So that woman can actually still get pregnant. But in a situation whereby it has affected your womb, they have to remove the womb so that it doesn't spread further. So in that case, a woman that has had the womb removed will not be able to get pregnant. So that is it.
All right, this is the Health Talk here on AETV Live, and I'm your host, Oga Gaikama. The topic has been cervical cancer. It has been an educating time. When we return, it will be time for us to highlight the major treatments of cervical cancers, talking about surgery, chemotherapy, and radiotherapy.